About 20% of the population, that's more than 50 million people, live with chronic pain. A massive opportunity for Big Pharma, to be sure, but an alternative treatment is closer than you think. Let's welcome Dr. William Richardson, founder of Southern Grace Precision and Aesthetics. Great to have you with us.
Thank you for having me.
So you do aesthetic treatments, but pain management is a big part of your practice. So when you hear those numbers, 50 million people that are affected by chronic pain, that's a lot. So what are some of the alternatives?
Well, I've been doing pain management for about 15 years, and I did the traditional route with multi-specialty practices for a long time, but one of the problems that you see is that they call it pain management, that there's no way to fix it. You just have to deal with what you get. You're just kind of treading water, which is really unfortunate because patients get depressed, they get frustrated. A lot of times they turn with, like you said, medications. Sometimes there's a specific kind of an injection, epidural injections, which is kind of a common one. And there's this revolving door that patients get really frustrated with. They come in, they get a pill, they get a shot. Neither of them really work very long or very well. And then they just get frustrated and they either turn to surgery as a hopeful cure, which most of the time it's not. It leads to other problems. And so as I started to develop my own practice, I was looking at other ways to bring about a difference for the patients. And what typically happens is that we take a multimodal approach. So we work in physical therapy, which a lot of people do, but we also bring in stem cell therapies, laser therapies, and even some of the aesthetics things, they overlap into that with muscle contraction and stimulation to help grow these muscles, get them stronger so that they can get back to a functioning, livable lifestyle without just depending on this pill or this kind of revolving injection.
Yeah, from what I've heard is that things like Botox, which we would normally use to look youthful and attractive, are used for pain, not medication, but it helps with migraines.
Correct.
It helps with other areas of pain. And can you describe some of those other opportunities to use Botox?
So Botox is one of the things, we don't use that as much for cervicalgia or headaches like you're talking about, but in terms of the aesthetic world, we have some what they're called body composition devices that help with muscle contraction. And so it's like going to a gym, but somebody that can't go to a gym, or they go to physical therapy and they hit a plateau. And a lot of people in chronic pain, they're an older population. So how do you get somebody that doesn't get muscle development like a 20-year-old to bridge this gap? And so we have these machines that actually cause this contraction, will increase muscle growth just by that stimulation, and they're just laying there. But it's a workout. They'll do 15,000 contractions in about 15 minutes. Is this
electrical stimulation?
It is. It's a deep muscle contraction, but it's the whole muscle belly plus ancillary muscles. And so it actually will increase. Athletes will have to break a plateau if they're going to use it that way, but we can use it from a rehabilitative standpoint to increase their strength. We use stem cell therapies to help with pain, such as PRP is a really common one. It's called platelet-rich plasma, where we use your blood products. We use laser therapies, and so lasers can manipulate the cell and then increase the healing process in tissues.
I actually, we have a chiropractor that comes to join us every now and again, and he uses red light laser therapy. So what is it about the red light that is so healing?
So it's just a certain wavelength that stimulates the nucleus of the cell, and it actually stimulates that, as well as there's a little engine in our cells called the mitochondria, and that's what we run our body on, this currency it makes. And so the laser light at that certain wavelength with the red light activates both. So we have more money to prepare the tissue, so to speak, and then the cell actually increases the tissue repair.
When we're talking about chronic pain, what are the most typical types?
I used to think that we just dealt with spine, but honestly now I deal with everything. We have bone, soft tissue like muscle, tendons, and then even nerve. And so it's been an interesting change now that we've opened this practice, because what I used to do so often, now we really see a little bit of everything, even pelvic pain, which is not something I do a lot of, but we get it.
But it's important to point out the fact that the spine, you're not just talking about back pain, because the spine really does control everything in your body, including organs.
Correct.
So you could have chronic pain in an organ or elsewhere in your body, and it really is caused along that spine in some way.
Right, that's absolutely right. It's funny how organically we've grown into these other modalities. One of them, when you're talking about organs, is hormone therapy. We've really embraced one of the things that I really looked at when we were first doing pain management was to use testosterone supplementation to help with the muscle development as well. And the risk for testosterone is not nearly what we used to think it is, as long as it's treated appropriately. But from a multimodal approach, the hormone therapy, whether it be women with estrogen and testosterone or men with testosterone, they have a huge benefit from a cardiovascular standpoint, muscle aches and pains. So some people have these systemic problems that we use hormones for just to treat their pain.
Oh, interesting. And with just a few seconds left, so of course, if you look good, you feel good. So what are some of the things that you do, superficially speaking? Yeah,
that's right. That's one of the reasons that we've branched into the aesthetics, is that people feel better and they sort of want to look better. They take better care of themselves. So we have about 7 different lasers and machines that we use for devices, but we really pride on a less painful approach. It kind of overlaps with that. So we use microneedling for skin and scar tissue, and it's usually quite brutal, but we have a machine that
builds up the collagen in your skin.
That's right, that's right. But it's very minimally uncomfortable. You really don't even need a local aesthetic.
They say that you can just do it over lunch and then come back to work and no one will be the wiser.
That's right, that's right.
Except you and your doctor.
That's right.
All right. So anybody who wants more information on your services, where should they go?
Go to our website, www.southerngracepa.com, or give us a call at 854-999-8300.
Dr. Richardson, thank you so much.
Thank
it's been
you.
Fun.
Very nice to meet you.
We're back after this.